I spend on helping an elderly or a handicapped person. It's a time-based currency where 1 hour of this kind of services you get into your account. It's electronic. Okay? So it's a savings account. What can I do with that? Well, first application is, let's say I have a flu, and well, I give a phone call and someone picks up my kids that are part of the network. It's not just an unknown person, you know, it's someone I can rely on, right? Now, what's fascinating is that they made a survey among the elderly people themselves, and they asked the following question: what do you prefer? The services provided by people who are paid in yen, in the national money, or services provided in Fureai Kippu? Universal answer, Fureai Kippu. Why? The relationship is different. That little old lady in my street represents my mother for me. So if her rice needs to be cooked a little more, I will do that. That feels itself. They perceive that. So we have actually a demonstration here that different types of money create different relationships. It's one of cooperation rather than competition.
I hope to challenge the assumption that older peoples are burden, putting a burden on health and social care system. Lots of older people are contributors, and this is clearly true when you see the active members of Fureai Kippu schemes. The majorities are 60s and 70s plus. I'm involved personally and professionally in older people who are very vulnerable and need some support and care. But the problem is they are often financially also vulnerable. But at the same time, there are a lot of women who are outside the market economy but want to help or want to contribute something. And then they actually help for nothing, which we call volunteers. But the problem is these kind of vulnerable people feel embarrassed or feel reluctant to receive some assistance or informal care for free. So if older people give currency, they feel they are to some extent entitled to get some help. Some Fureai Kippu schemes extended and have branches across Japan or even outside Japan, in Los Angeles, in Switzerland, and now in London. This means a healthy member help the neighbor in Los Angeles, then she can earn credit and she can send her credit to her elderly mother living in Tokyo, where the elderly mother can get regular help from the member living in Tokyo. So this means actually the credit can enable long distance care using credit which are transferable beyond localities or beyond the country. Unfortunately, it's not. But I don't think it's a bad thing, because this kind of huge movement actually pushed the government to take more responsibility. Then in 2000, in Japan, the government finally introduced the national compulsory social care system for older people and disabled. It became people's right to access to care under that national system. And also, from members' point of view, lots of people who got this kind of experience actually moved to formal employment, and then actually can earn money under the usual economy. But the majority of people actually stay and prefer to provide care under the Fureai Kippu system.